Warning: the upcoming federal changes to healthcare could have significant repercussions for the Tri-Cities area, impacting nearly everyone. This was the urgent message conveyed by healthcare leaders during a meeting with Senator Patty Murray, DWASH, in Pasco this week. Senator Murray did not mince words at the press event held at Tri-Cities Community Health, stating, "The stark reality we face is that a bill endorsed by Republican lawmakers has severely curtailed Medicaid access, resulting in millions losing their health coverage, escalating healthcare costs, and pressuring healthcare facilities nationwide to close their doors." Joined by leaders from a local birthing center, a regional hospital, and various family care centers, she emphasized the importance of raising awareness about the looming crisis. Brian Gibbons, president of Astria Health, echoed her sentiments by warning that the entire healthcare system's stability is in jeopardy. The legislation known as the One Big Beautiful Bill signed by President Trump could lead to higher costs and limited access to healthcare. The senator highlighted that certain tax credits for health insurance, crucial for helping middle-class families and small business owners, are at risk of expiration. It is crucial for everyone to grasp that this could result in a dramatic surge in insurance premiums, she stressed. In Washington state, nearly 150,000 individuals who rely on the health insurance exchange, Washington Health Plan Finder, may find themselves unable to afford coverage due to these changes. These individuals currently lack employer-provided insurance or government-funded health care. Data from the Washington Health Benefit Exchange reinforces this alarming prediction, suggesting that approximately 80,000 individuals would forfeit their insurance without these essential tax credits. Notably, over 200,000 Washington residents benefit from these credits, with an average savings of $1,300 annually, which the current legislation threatens to eliminate. Senator Murray provided a stark illustration. Consider a couple age 60 earning $82,000 a year. They could see their health insurance premiums skyrocket from just under $7,000 to over $22,000 annually. The impact of these anticipated changes is already evident, as insurers in the marketplace have requested the largest premium increases seen in over 5 years, with state reports indicating an average rate hike of 21%, attributed in part to the possible discontinuation of tax credits. Maternity and childbirth. A grim outlook with the implementation of the One Big Beautiful Bill. Washington state stands to lose an astounding $31 billion to $51 billion in Medicaid funding over the next decade, marking the steepest cuts to the program, known as Apple Health in Washington, in history. Cynthia Flynn, a partner and manager at Columbia Birth Center, predicted, as Medicaid eligibility diminishes due to these cuts, it is an unfortunate reality that women will still give birth, often arriving at emergency departments without any prenatal care. In Washington state, approximately 35% of births are financed by Apple Health, with that percentage particularly elevated in the Tri-Cities area. Flynn highlighted her experiences from working in countries where only affluent individuals received prenatal care, witnessing devastating aftermaths such as stillbirths and maternal hemorrhaging. The U.S. currently ranks a disappointing 69th globally in maternal mortality, indicating that mothers here are less likely to survive childbirth than those in 68 other nations. The alarming trend of rising maternal mortality rates exists solely in the U.S. Among industrialized countries, limiting access to Medicaid services and reducing reimbursements will only worsen this troubling trend, Flynn stated. Our healthcare system is failing, and diminishing Medicaid does nothing to improve maternal and infant health. The strain on hospitals. The changes approved in the nation's healthcare system imply a troubling future where more patients arrive at hospitals without insurance or the financial means to pay for their care, warned Gibbons of Astria Health, which operates facilities across a wide region from Yakima to Grandview. Under the Emergency Medical Treatment and Labor Act, EMTLA, hospitals are required to treat patients even if they lack insurance or funds. But Gibbons pointed out the unsustainable nature of this mandate. While we take pride in serving every individual who enters our facilities, the reality is that this model is no longer viable Gibbons clarified that EMTALA functions as an unfunded mandate that jeopardizes the financial health of rural hospitals like Astria Health. In our communities, where Medicaid currently acts as a lifeline, cuts to reimbursements transfer the financial burden solely to hospitals. This is particularly damaging in areas with few large employers or limited access to private insurance options. There exists a critical misunderstanding among some that the One Big Beautiful Bill only affects non-citizens' healthcare access. Gibbons cautioned, the truth is much graver. When hospitals are compelled to shut down departments, consolidate services, or completely close due to financial constraints, it's not just one demographic that bears the brunt of this crisis. It impacts everyone, working families, the elderly, and children alike. The role of Tri-Cities Community Health. If Tri-Cities Community Health cannot maintain its services due to the loss of Medicaid funding, Chief Executive Christy Needham warned that patients may find no alternative but to seek care in emergency rooms. This safety net health provider serves around 29,000 residents in the Tri-Cities area and relies on federal funding. We all recognize that emergency rooms are not suited for managing chronic illnesses like diabetes or asthma, addressing mental health concerns, or providing routine vaccinations for children, Needham explained. Emergency care is more expensive, less personalized, and already operating at full capacity. To stay afloat, hospitals are compelled to find ways to cover service costs, often passing on uncompensated care expenses to all patients and insurers. The One Big Beautiful Bill aims to thwart Medicaid fraud and mandates individuals without disabilities or caregiving responsibilities to work, volunteer, or pursue education to qualify for Medicaid or Apple Health in Washington state. However, Murray noted that most individuals enrolled in Apple Health are already employed. In rural regions, finding stable employment can be quite challenging, and work hours can fluctuate significantly. If someone's hours drop below 20 per week, they could lose their Medicaid coverage due to these new stipulations, she explained. Murray urged families to comprehend the implications of these changes to healthcare coverage. The cuts included in Trump's legislation will directly impact hospitals and healthcare providers' financial stability. In Washington state alone, hospitals stand to lose $662 million in Medicaid revenue each year, which could lead to staff layoffs, service reductions, or even closures. She emphasized the reality that having insurance means little if healthcare services are not available. People do not want to see their community health center close its doors, or to lose the hospital upon which they depend for care. No one wants to lose their health insurance, and no one wants their neighbors to face such a fate either. What are your thoughts? Are you concerned about these potential changes? We want to hear your opinions. AC Senior Staff Writer Annette Carey has covered topics related to Hanford, energy, the environment, science, and health for the Tri-City Herald, bringing more than 3 decades of journalistic experience in the Pacific Northwest. If you appreciate my work, consider supporting it through a digital subscription.